Hello, everyone. Good afternoon, everybody. I'm Priyanjali from the Resonance Show YouTube channel. I'm sure all of you are doing well and taking good care. Today, we are going to talk about a very common yet confusing problem: repeated sneezing, runny nose, blocked nose, headache, or constant cold like symptoms. Many people often wonder, ये normal cold है, साइनस का प्रॉब्लम है या कहीं एलर्जी तो नहीं, because the symptoms look very similar. Most people either ignore them or keep taking over the counter medications without knowing the real cause. But did you know that allergic rhinitis is one of the most common reason behind long-term nasal problems? If not identified correctly, it can disrupt sleep, work productivity, and overall quality of life. So, today's session is all about helping you understand how to differentiate between cold, sinus, and allergy, what exactly is allergic rhinitis, and when you should consult a doctor instead of self medicating. To guide us on this topic, we have with us today an experienced and trusted expert. Please welcome Dr. Megha Panjiyar, a renowned specialist joining us live today. Dr. Megha Panjiyar is a DNB ENT. She is currently practicing at Dr. Megha ENT Clinic and Allergy Center, Andheri. She has over two fellowships in allergy, which are ASSC and FAAP. And with that, I would like to welcome her to today's screen. A very warm welcome to you, Doctor, for joining us today. And without a further ado, let's dive into the topic. Today's discussion is going to be on, is it cold, sinus, or allergy, and how to differentiate allergic rhinitis. With that, let's dive into the first question. Doctor, many patients confuse cold, sinus, and allergy. What is the first clue that points towards allergic rhinitis?
Yeah, hi. Thank you for welcoming to me for the show. And yeah, this is a very common problem which patient face. Many times you see patients coming to OPD and they say, "Madam, I have sinus." So by sinus, what do you mean? First, I have to ask them, "Yeah, are you aware you have sinus, you have cold, you have allergy? What do you have?" Then on further history, the first symptom which patient should catch is their itching. The patient says, "I have itchy nose, itchy throat. I keep on itching everywhere." So just itching is the main significant symptom which patient comes with. This is also associated with running nose, cold, nasal drip. So if a patient has itching, which has itching in nose, ears, throat, if it is continuing from for a long period of time, they probably are suffering from allergic rhinitis along with nasal drip. So they shouldn't get confused. It is a sinus issue. It is a cold. Cold is always short term. So only by symptoms of itching, nasal dripping, nasal blockage, they should figure out more. It should point more towards an allergic rhinitis.
Right. Doctor, what is the duration of symptoms which helps us to differentiate a common cold from allergic rhinitis?
Common cold is an acute condition, whereas allergic rhinitis it is a you can say a long term condition. It can be seasonal, perennial. So basically, cold it lasts for a week or two. Rarely it lasts more than 2 weeks. But cold you can say it keeps on going. Patient recovers and again they face the same symptoms. It goes on for weeks and months together. For a seasonal cold, they particularly is during a particular season. They say in a particular season I get more of running nose cold, but as you know, cold flu, normal flu is more of a short term course.
Right, right.
So chronic
Now, moving into the
chronicity
next
is
topic, doctor. Uh, yes, 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 doctor. Yes, doctor, can you hear me?
yeah, I can hear you.
Right. Doctor, let's talk about the early symptoms, which uh, which is the major thing when it comes to any condition or any disease, recognizing the condition. What are the early symptoms which one should take a note on?
Okay, so if you want me to discuss more about what should be the early symptoms of cold and what helps to rule out allergy and a common cold, it will be fever. The classical symptoms
Right.
will be fever, body ache. The patient comes and complains, I'm having fever, little running nose, itching nose, cold, dripping of nose, and I have a body ache. This points more towards their acute symptoms of cold. If the patient is complaining of no cold, but rather than other complaints of cold, that will be itching, running nose, then it is more of a allergic rhinitis. So the first symptoms which we look for is the clinically on symptom wise is body ache, fever, sore throat. And clinically, if we
Mhm.
examine, we do find there is quite thick mucus discharge in their nose, their throat is red, they have pharyngitis, they can have tonsillitis as well. And in sometimes they have enlarged lymph nodes as well. So
Right.
these things point away from their allergies.
Right. Right. Now coming to the kind of allergy that we are talking about, which is quite similar with cold. We normally tend to not visit the doctor in such cases. We tend to treat ourselves, and the medications are always available at home. Uh, no matter any medications to treat cold and cough, they are available next to us. So, how does these self medication hamper our health? Or does it somehow work when we take such medications for allergic rhinitis as well?
Yeah, you'll find a counter full of medications, antihistaminics. I mean, people take it left and right. Daily, they are on antihistaminics, and they come and tell, "I take a levocetirizine, and I'm okay with it." So
Mm.
this is the first thing which when the patient says, we get to know, okay, it's allergic rhinitis, and you have been not treated well since long, or you're avoiding consultation since long. So if you feel taking a tablet, it goes off, it is definitely allergy. Taking an anti-allergic, your itching stops, nasal drip stops, it is an allergy. But sometimes you get confused when it is cold or it is allergy, I should visit a doctor or not. So you should have a thick nasal discharge, you should be having your body ache, fever, everything what I already mentioned. So you should meet an ENT when you have perennial running nose, cold, or itching in throat, and paroxysm of sneezing, I would say. If you have multiple sneezing in a row, it stops by taking medication. Yes, it is allergic rhinitis.
Right, right. Another issue when it comes to any sort of cold or allergy is what if the person next to us also gets it? So somehow, is it contagious? The allergic rhinitis that you're talking about, is it contagious?
No, allergic rhinitis per se is not contagious. You can say a common cold is rather contagious. Allergic rhinitis is more of
Mm.
a genetic condition in which whole of the family, or they can be skip generation also, whole of the family is affected. So it is not a communicable disease, but yes, it do runs in family. But a cold, it will be infectious. One after other, every member in the family will be affected by cold.
Right, right. Now, doctor, what nasal symptoms are typical of allergy but uncommon in viral cold or sinusitis?
Typical of allergy will be intense itching, paroxysm of sneezing. Intense itching, paroxysm of sneezing is usually not there in common cold. By paroxysm of sneezing, I mean patient get bout of sneezing, they keep on sneezing 10-20 times. So that is the major factor which differentiate them from allergic rhinitis. In allergic rhinitis, you'll have itching in nose, burning sensation in eyes. You'll have intense, profuse nasal discharge as well. In common cold, you'll have profuse discharge, but in allergic rhinitis, you'll have clear, watery kind of a discharge. So constant rubbing,
Right,
dark circles below the eye, that all points towards your nasal allergies.
right. Now, earlier, doctor, you were mentioning the itching part. So, how important is itching nose, eyes, or throat in diagnosing allergic rhinitis?
The allergic rhinitis is basically a allergic reaction. In it is what we call in medical term, it is a type 1 hypersensitivity reaction. By type 1, I mean it is all histamine related. So when there is too much of histamine release, it causes itching. It is same as when you eat a pineapple too much, your throat starts itching. Same way, if the body histamine levels are quite high, And if a series of hypersensitivity reaction goes on exposure to allergens, you have those itching symptoms in the nose. So,
Right.
yes, your second part of the
Right.
question was?
So how important is it in diagnosing allergic rhinitis?
Yeah,
The
so that
itching of
becomes the
nose, eyes, and
classical
throat.
symptoms. Yes, that becomes the classical symptoms. You'll find patient with allergic conjunctivitis as well. So allergic itching in eyes, gradually untreated, they goes towards the allergic conjunctivitis. So it becomes the patient basically goes into some allergic march kind of a thing.
Right. Right. Uh, Doctor, what about any internal body part which is involved apart from these external nose, eyes, and throat that we're talking about? Any other internal body parts? Is it something to worry about? Uh, what about the sleep disruption that we are talking about earlier?
Yes.
How does this disrupt our sleep? The allergy.
Once, once you are having nasal blockage, your nose keeps on dripping. You will have the the lining inside the nose, it swells up. So you have a nasal blockage. So once you go to sleep, you keep on mm, keep on building up that nasal blockage. Your sleep goes. At a point of time, your nose is completely blocked. So that's the time when your brain signals you, oh, okay, your nose is blocked. You need to get up and start breathing again. So sort of sleep apnea also, you can say, you also start getting sleep apnea symptoms. So if you don't sleep at night, the next day you will be tired. Your daytime sleepiness score increases. You will be standing in traffic. The irritation throughout the day will increase. While trying, you will feel like you are sleepy. In short signal also, you'll feel like sleeping. While reading newspaper, you'll doze off. So these are
Right.
allied symptoms which patient complains of, that I'm very sleepy throughout the day. I feel tired, mental clogging. I'm not feeling fresh. That's what they'll complain with.
Right. 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 Doctor, what about the social triggers, the seasonal triggers like pollen or cough burning, strong indicators of allergy rhinitis?
First understand allergy. Allergy can be seasonal or it can be perennial. Depends on the allergens which you are exposed to or allergens which you are sensitized to. So in um, seasonal allergies is basically because of the pollen, and we have something called as pollen calendar. It depends when the plants are blooming, when they are having pollen. So different patient gets allergy symptoms in different seasons. Sometimes they get it during the crop harvesting season, during the burning of the crops. These symptoms strongly suggest towards the seasonal allergies. In perennial allergy, I mean throughout the year, these patients are more sensitized to house dust mites, cockroaches, or any fungal molds on the wall. So these point more towards the perennial allergies. But yes, if they're complaining, okay, in the month of April or in the month of November specifically, I get allergies, then it is a seasonal allergy.
Right, right. Well, doctor, when does this sinusitis usually develop? And can untreated allergy trigger sinus problems as well?
Yes. Coming to the sinus problem, first there should be a trigger. That trigger is allergic rhinitis. For the triggering of allergic rhinitis, patient should have a genetic factor which they are predisposed to. Then there should be some anatomical errors which triggers allergy. By anatomical errors or variation, I mean they can have a deviated septum or any other anomalies inside the nose. When you start getting repeated allergic rhinitis, repeated sneezing, bouts of sneezing, the inside the mucosa of the nose, they swell up. When you have running nose cold, because of the nasal swelling, your sinuses doesn't drain well. If there is not much drainage of the sinuses, all the mucus which is secreted inside your nose, it stays inside the sinus. It leads to sinusitis. See, sinusitis and allergic rhinitis, you can see sinusitis becomes a sequelae of allergic rhinitis in a long run when it is not treated. The stagnation of the allergy mucin inside the sinuses triggers inflammation in the sinus, and that is called sinusitis. So taking proper medication during the start of allergic rhinitis is a must.
Right, right. Um, Well, doctor, how useful is response to antihistamines in confirming allergy versus cold?
Okay, see, for a clinician, the first thing which we get to hear from an allergic patient, I took this tablet, cetirizine, levocetirizine, whatever it be, I took this tablet and I'm relieved. So that the only history suggests which you are suffering from allergic rhinitis is you're anti-allergic. Anti-allergic, I mean, they are antihistaminics. So as I already said, itching was the main complaint which patient had. It is the more classical symptom, the most classical symptom which is representative of allergic rhinitis. So if they take a tablet, that gets better. So it points more towards an allergic rhinitis.
Right, right. So can these long-term usage of medication somehow be helpful, or can it somehow, worsen the condition?
Yeah, see, any medication, any oral tablets taken, you have a systemic effect of all the oral tablets. Even if it is very safe during all the courses of life, even if it is very safe, but still it leaves a mark on your body. So rather than popping a tablet daily, a topical treatment, by topical treatment, I mean something which you apply inside the nose or the sprays, or it can be any nasal washes, is much more effective. So popping a tablet daily, I wouldn't recommend much. We right now the modality of treatment has changed a lot. You have long-term treatment, long-term use of nasal steroids, nasal corticosteroids, we call it nasal sprays. So long-term treatment by nasal sprays is no day harmful. You can take it throughout your life. There is no side effect of it. But yes, popping a pill here and there, you will be having some side effects.
Right, right. Now moving ahead to the children. In children, doctor, does allergic rhinitis present differently, or what should we watch for normally when it comes to children?
Okay, when coming to children, allergic rhinitis treating in children becomes a very tedious task, because you and me can come to the physician and speak. Okay, I'm having itching in nose. What will a child do? They won't say. They'll keep on rubbing their nose like this. So observing a child
Mm,
by the parent and the clinician is the main utmost importance. In children, they keep on rubbing their nose. So this is the position we call it as allergic salute. Because of rubbing, frequent rubbing of the nose, they start getting a line over here. Observing a child who is not speaking much, even in a 6 year, 7 year old child, they can't express themselves much. So we have to look for the
mm,
clinical signs and symptoms. One is allergic salute, which I explained you. Second is their sleep gets disturbed. So they stay hyperactive throughout the day. They stay irritable rather throughout the day. They start developing dark circles around their eyes, which we call it as allergic shyness. Their poor
right,
sleep, irritability, frequent rubbing of nose, mouth breathing. These are the clinical signs and symptoms which we explore for in pediatric. But the cardinal symptoms of nasal blockage, your heaviness in nose, the nasal grip remains the same. The itching in the nose remains the same. The only difference is kids don't say and adults do come up and sleep. Because of their nasal problem, many a times they kid complaints of ear blockage as well. They complain completely, my ear is blocked, it is itching. I'm not able to hear properly in class. So these are
mm,
one of the symptoms which they complain. When we examine, we find there is fluid behind the eardrum. How does the fluid behind the eardrum develops in an allergic kid? Because their allergies are not treated. Their sinuses are full with mucin. Their eustachian tube, what we call the connection between the nose and the ear, that gets blocked, and that's how they start developing fluid behind the ears. So checking the ears is also very important in kids. Usually adult and kids both have both goes into a clinical condition we call this as allergic march. In allergic march, you have first you develop eczema of the skin, atopic dermatitis. Same skin, atopic dermatitis in kid is very common, so that becomes another pointer for allergic rhinitis. So in allergic march, you have atopic dermatitis, eczema of the skin, you have food allergies, and later on, gradually further in their life, they are tend to develop bronchial asthma as well. So treating allergy in early stage in kid is very important.
right, right. Uh, Doctor, what about home remedies? How does they work when it comes to allergic rhinitis?
Okay, by home remedy you mean food restriction or cleaning up the home?
Both.
Okay. So let's start with food restriction. Until and unless a patient is allergic to food, which is again proven by an allergy testing, no one should stop eating anything. That is deprivation is a nutrition deprivation. So any home remedy by stopping food, I wouldn't recommend until and unless we have done an allergy testing. Skin prick test, we won't recommend any home remedies by stopping food, you mean. In cleanliness wise, see the dust which we see on the surface of the room, surface of the table, bed, wherever, that dust is not actually the dust which you are allergic to. We call it dust mites. They are eight-legged arthropods which crawl inside your bed, your mattresses, your pillows. It stays there, and yes, they feed on the skin sheds which is there when you sleep. So cleaning the home, you should be cleaning the dust mites, not just the superficial dust which you see. So the home remedies can be,
Right.
yes, not ginger garlic tea, but home remedies will be thorough cleaning of your mattresses, your pillows, exposing them into sun,
Mm-hmm.
and changing the bed sheet, cleaning them, washing them in hot water. Around 50-55 degrees Celsius water is recommended to wash their beddings and their pillow covers. Frequent exposing the mattress, the pillow covers in the sun is another remedy which we suggest. Clearing of the molds from the walls. Your bathroom might also have lots of molds. By molds, you can see those black spots on the walls. So getting rid of those black spots on the wall is very important. So in home remedies, I would suggest allergen avoidance rather than food avoidance.
Right, right. And then we have another question for you, which is what are the common mistakes in diagnosing that delay proper allergic treatment?
Okay, so the common mistakes starting from the patient side. They keep on ignoring their allergy. Oh, allergy की treatment के लिए जाएंगे तो डॉक्टर 10 दवा prescribe करेंगे. Just let's take one cetirizine, levocetirizine, whatever, and we are okay to good to go with. The first mistake from
Right.
patient side, they present very delayed. From clinician side, I would say treating a common cold and allergy because the symptoms remains almost the same. So again and again,
Mm-hmm.
physician might prescribe them antibiotics. They might prescribe them anti-allergic as well. So ignoring their itching symptoms, ignoring their triggers, ignoring their long-term uh, long-term health risk. These are the common symptoms which from the clinician side we ignore many a times. Then if you're not meeting a allergy specialist, your skin prick test to diagnose the allergy is delayed. By skin prick test, we test many common allergens. We have a panel of lots of allergens which is commonly there in the air. So that is why I was talking about the pollen calendars. So what all pollens are there in the surrounding areas in your city, we test for that. So delay in allergen testing, what you are sensitized with, is a mistake which is done from clinician side. The another delay in the treatment with starting with immunotherapy is also present. Right now, the patients are also very reluctant to start with immunotherapy. Doctor, it is a long-term treatment. Goes for 2 to 3 years. How much benefit do I have? I don't know. I have to invest so much. So from both the side, there will be little hesitation in starting with the immunotherapy treatment.
Right.
The another drawback in diagnosing and treating it is, see, many patients avoid surgeries. Even we are not very pro to operate and treat allergic rhinitis. Allergic rhinitis is a basic medical condition which is triggered by their genes. But yes, the triggering factor lies in the nose. There might be some triggers in the nose which is causing increase in the allergy in the patient. That can be deviated nasal septum. There can be any blockage in the sinuses, in the opening of the sinuses because of some bone variation, concabulosa, or any other variations present in the nose. So going ahead with the first stopping the triggering agent and then going ahead with the medical line of treatment is what we prefer. Plus, yes, allergen avoidance, which all I talked, washing the mattresses and keeping your house clean. So these
Right.
things shouldn't be delayed.
Right. Now, I can see a few questions coming up from the viewers. The first viewer asks, are nasal sprays safe for long-term use?
Yes, nasal sprays are very safe in long-term use. It is safe in pregnancy as well as kids as well. Plus 2 years, it is completely safe.
Right. The next question comes from Rekha Tirke, who asks, can turmeric help reduce nasal allergy?
Okay, I shouldn't be falling into the trap of homeopathic medications and turmeric prescription.
Mhm.
See, turmeric as such, we know it has its medicinal property. It increases the immunity. It works as an immune booster, but your overall immunity should increase to reduce your allergic rhinitis. Just turmeric won't help. Turmeric, taking turmeric milk or eating turmeric will only lead to your gastritis, not reduction in your allergic rhinitis.
Right. The next
You should
question
focus more
comes.
on increasing your overall immunity, running, jogging, taking, having a healthy lifestyle, not just turmeric.
Right. The next question, doctor, comes from our next viewer who is Manav Khan asks, can keeping windows closed during pollen season help?
Yes, it do help. Uh, Rather than a pollen season, pollen time closing, keeping the windows closed during the pollen time is also important. That becomes early morning season when you see the sun blooming and the flowers also starts blooming. That's the time when pollens are taken off in the air. Same in the evening, closing the window during the evening time also helps because that's the time when the air is windy, the pollen gets washed off from the trees and it, yes, do enters through your window. So keeping it closed is a better option.
Right. The next question comes from Syed Rehan asks, can allergic rhinitis affect sleep and daily life? I think we have already talked about it, but then do you want to put any inputs into it?
Yes, allergic rhinitis cause tiredness throughout the day. You'll be having mental clogging. You'll keep on getting up regularly at night, sniffing, blowing out your nose, and then going back to sleep. So yes, it do affect your daily life.
Right. And the last question comes from Mithali Sharma asks, does wearing a mask reduce allergy symptoms outdoors?
Yes, it does. It stops the pollen. The right now there is too much pollution, so the pollutant material, the pollutant particles, ppm, what you call, is it gets loaded with the pollens. So once you inhale that dusty pollution, those smoke and all, the pollen enters your body and it starts the whole sequence of your allergic rhinitis. So yes, it is recommended to wear a mask.
Well, those were all the questions that we had for today's session, Doctor. It was a wonderful session. We got to learn a lot from you. Before we take a leave, any take-home message for our viewers who has watched us so far?
Yes, do not do not ignore your allergies. It is a very treatable condition. Yes, the long-term treatment is, it is a long-term treatment therapy which you require. But meeting an allergist, meeting your physician is what you require. Don't get burdened by allergy symptoms. It is completely treatable. You can live a healthy life. You can live a life as normal as a normal person without sniffing again and again, without blowing out your nose in front of everyone and saying that I have sinus issue is not any day recommended. So instead of landing up in some complications related to your sinusitis or allergic rhinitis, it is better to come up and share your complaints and get treated.
Right. Well, that was the expert advice for today. And we would like to thank you, Doctor, for your valuable time and for all the practical insights that you have shared with us today. This session has surely helped our viewers understand the difference between cold, sinus, and allergy, and why identifying allergic rhinitis early is so important. We truly appreciate your time and your expert guidance and look forward to having you with us in our future sessions. Also, thank you, viewers, for your excellent participation. Stay connected to the Resonance Show and do not forget to like, share, and subscribe to our channel. This program is brought to you by the makers of Bilacet M, Vertigen, and Opox CV200. We would like to thank you all once again for joining us and staying with us. You all stay safe and stay healthy.
Thank you so much. Thank you for inviting me for the talk. Thank you.
Thank you so much, doctor.